Hi, I'm Kristy,
I'm Ashley,
and we are your sim crew. And we're going to go over the 4th semester nursing Ted and Henry simulations. We're going to go over the general ideas for what you should remember when you come into sim, and then Ashley will review the simulators on an individual basis. So the first thing we just want you to keep in mind is that the whole room is your playground. When you come into sim, the simulator that is in this location of the room closest to the glass is going to be the patient that you'll be working with first. Everything is on wheels, so remember that you can move things around. We have your equipment is going to be kind of out for you, like on bedside tables or in the patient supply cabinet over there in the corner. But you also have your workstation here that is on wheels. You can move with you. Remember to do your med checks here, 2 here, then last one over there on the side of the bed. Then you also have your med cart with your medication tackle box. Remember that we do not take anything out of the medication bags or anything like that, but we will put everything in the white basket. When you administer meds, you will put them in the white basket in the blue recycling bin. And then also remember that all sharps will go in the sharps box that is on the wall, not in the garbage can. There we go. Also remember that the beds can go move up and down so that you can help the patient breathe better and whatnot. But with that, the simulators are plugged in, so be careful how far you pull that bed up and down so that we don't unplug the simulator. You're going to have 2 patient scenarios for this particular simulation. You'll have one at a time, and we'll just switch the beds around for you. The patient ID is on the patient's arm, so you'll know who you're dealing with. And then when you do your first assessments on the patients, what we're going to do is this will be covered kind of like this. You'll do your first round of assessments with the patient, which is your heart rate, your respiratory rate, your lung sounds, your temperature, blood pressure, blood glucose, and then once you get that done and written on the whiteboard, then we will tell you that you can turn this over and this will display a patient monitor for you. Remember to wear gloves and verbalize hand hygiene. We don't have to change your gloves 15 times. If there are any roles or actors that will be coming in, like role players, into your scenario, they will announce who they are when they come into the room so that you know who you're dealing with. And then the patient chart. So when we're looking at the patient chart, this is Henry's patient chart. Remember that your patient orders are in here, but your patient demographics are in here too. So patient orders are going to be pink, remember. And then remember that when you come to a page that says, it's kind of small here, but it says, please do not open until you're instructed to do so. That just means that we're not at that stage yet, so do not open this folder right here until you're instructed to do so. But remember that there are other folders in your patient chart, like labs. Sometimes there's images. You will want to go through your patient chart to see what's going on with your patient. So that's always going to be on your workstation. And then don't forget that you have your MAR and whatnot for both scenarios. You'll be expected to document on there like you're supposed to, with pencil only. Now I'm going to turn it over to Ashley, and she's going to review the simulators.
Perfect. So your first patient will be Henry. So just a few things that are specific to him. He is wearing a silicone face mask, just so that we can make him have more realistic characteristics. But if you have any questions about his appearance and what is real, you can just always ask us. He is set up for your sim, so everything that you see here will be relevant for your scenario. And then he does have some extra resources here on the table. So you do have a spices form, a stop and watch early warning tool, and then a care path symptoms of shortness of breath tool. You guys are free to write on this with pencil and do what you need to do with those. Okay? As Kristy said, the patient that's here in this position is going to be the one you're caring for. So Kristy and I will move the patients around for you. So once Ted is over there, you will be treating him. Again, he's set up for your scenario. He does have an IV here. It's not hooked up, it's just clamped off, but if you needed to do like an IV site assessment, it's free there. He's got his name band. And then he does have under his gown here, kind of like, oh, sorry, Kevin. Kind of like a under tank, if you will. It's like this beige color. This is considered his skin. So we do want you to like take off the bandage and stuff like that, because treat this as the patient's skin. Okay. He also has a Foley, so I'm gonna come over here. You can just verbalize any kind of Foley care because it's a simulated environment, but we do want you to assess his Foley bag here and like look at the urine and stuff like that. If you have any other questions, you can always reach out to Kristy or myself, but this is kind of your scenario for Ted and Henry.
All right.